Hi there, my name is Dr. Neil Verma. I'm the Chief Medical Officer at Medical Pillars. I'm an interventional pain specialist, a wellness practitioner, critical care emergency physician. I'd like to go over today a patient's blood work and what we do to interpret what's happening with them when we see them in office. I practice interventional pain medicine, and this patient presented. She was a 43-year-old female that I saw for back pain and headaches. And part of looking at what was happening with her is that she was overweight and making poor choices with food and looked tired and had bags under her eyes and was on a constellation of pain medications and coming in weekly for injections. So we decided to do blood work on her. And the first thing that I look at when I do blood work is I have a look to see what's happening with their hormones. And the first hormone I look at is cortisol. Cortisol is a major stress hormone. It's what we use in practice to gauge how sick somebody is and how much stress that they're under. So when I look at somebody's cortisol and it's elevated, high or low, is abnormal to me. And that gives me a good sense of what kind of sleep patterns they have, if they're getting enough restorative sleep, if they're under an amount of chronic stress, if they're under a certain amount of pressures that are happening, if they're going to be making appropriate decisions, how they're just coping in life. And all those things have such a big impact on how much pain that they feel. And unless you really attack cortisol, it's hard to get a real grasp of what's happening with their pain. Cortisol has a direct impact on their other hormones as well. So the other thing that affects cortisol, when cortisol is elevated, it'll steal energy from their sex hormones. And we all know that when our patients are stressed, that their libido is down, their energy levels are lower, their strength is down, and that directly affects their testosterone and their estrogen and their progesterone levels. We'll know that their mood is off. When people are stressed, they're just anxious, they're depressed, they have a lot of mental component that'll feed into the amount of pain that they experience. Furthermore, we know that when our patients are stressed and their cortisol levels are high, we'll see that they're tending to pack on more pounds, and that's going to affect their cholesterol levels. It's going to affect their thyroid function as it starts to affect their metabolism. Cortisol directly fuels into how much insulin is surging in the body. So we know that when our patients are given steroids, which is cortisol, it causes their sugar to elevate. And as a result of their sugar elevating, their insulin needs to surge in order to bring it down. And so cortisol will directly fuel how much insulin is in someone's body, which puts them at risk for diabetes and prediabetes. So it's really important to look at that comprehensively. I find that when we go after cortisol, we're able to really talk to the patient about dietary and lifestyle modifications that can put them on the path of wellness so we can better manage their pain.